This is our BMS anatomy revision video on the heart. In this video, we will be covering the function of the heart and its gross anatomy, the pathways of the blood through the heart, and the heart's embryonic remnants.
The heart occupies the middle mediastinum and is in the thoracic cavity behind the sternum. It is contained within a fibrous pericardium that attaches to the diaphragm and holds it in position. The primary function of the heart is to pump oxygenated blood to the vital organs of the body and to return deoxygenated blood back to the lungs so gas exchange can be carried out. There are 4 chambers in the heart: the right atrium, the left atrium, the right ventricle and the left ventricle.
The right atrium receives blood from the superior and inferior vena cava and also from the coronary, sinus and cardiac veins. Blood flows from the right atrium into the right ventricle through the right atrioventricular orifice, which is guarded by the tricuspid valve. The valve contains 3 cusps and is anchored by chordae tendineae to the papillary muscles of the ventricle. During systole, the papillary muscles will pull on chordae tendineae, causing the valve to close and preventing reflux back into the atrium. The right ventricle forms the largest section of the anterior surface of the heart and is the only chamber to have tuberculi carne. At this point, the blood then travels from the right ventricle to the lungs via the pulmonary valve. It does this at the level of the 3rd costal cartilage. The pulmonary valve contains 3 semilunar cusps and is forced closed during atrial diastole. Once through the valve, the blood passes into the pulmonary trunk, which divides into the right and the left pulmonary arteries at the level of the apex of the aortic arch. The arteries then deliver the blood to the lungs, where it is oxygenated, and then begins to return to the heart via the 4 pulmonary veins. The blood enters the heart at the left atrium. The left atrium lies behind the right atrium and forms the base of the heart. It receives blood from the lungs via the 2 superior and 2 inferior pulmonary veins. From the left atrium, the blood travels into the left ventricle through the left atrioventricular orifice that is guarded by the mitral valve. It is comprised of 2 cusps and is also anchored to the papillary muscles by chordae tendineae. The left ventricle forms the apex of the heart and contains extremely thick muscular walls, as it has to pump blood around the entire body. From the left ventricle, the blood travels to the rest of the body. It does this through ventricular systole, where the left ventricle pumps the newly oxygenated blood through the aortic valve and into the ascending section of the aorta. The aortic valve consists of 3 semilunar cusps and is forced closed during ventricular diastole. The ascending aorta pierces the fibrous pericardium surrounding the heart, where it then turns backwards and to the left, forming the arch of the aorta. After the arch, the blood travels through the descending aorta and into all of its subsequent branches.
The heart also has several specialised features that help it to perform its function more efficiently. The valves of the heart prevent backflow of blood during contraction. The mitral and tricuspid valves are supported by the attachment of fibrous cords, named chordae tendineae, to the 3 edges of their valve cusp. The chordae tendineae are in turn attached to papillary muscles, located on the interior surface of the ventricles. The papillary muscles contract during ventricular systole to prevent prolapse of the valve leaflets into the atria, which would cause a backflow of the blood. There are 5 papillary muscles in total. 3 are in the right ventricle and support the tricuspid valve, and the remaining 2 are located within the left ventricle and act on the mitral valve. The right ventricle also contains many muscular ridges known as trabeculae carneae, one of which is known as the moderator band, which connects the interventricular septum to the anterior ventricular wall, ensuring the heart beats in a synchronized rhythm.
There are 2 main coronary arteries which branch to supply the entire heart. They are named the left and the right coronary arteries and arise from the left and right aortic sinuses within the aorta. The left coronary artery splits into the left circumflex artery, left marginal artery, and the anterior intraventricular artery. Infarctions in the anterior intraventricular artery are often called widowmakers. The artery supplies most of the intraventricular septum, the anterior, lateral and apical wall of the left ventricle, most of the right and left bundle branches, and the anterior papillary muscles of the mitral valve. Therefore, if the infarction occurs in that blood vessel, then it is most likely going to result in death. The right coronary artery splits to form the right marginal artery anteriorly, and in 70% of individuals, it also splits to form the posterior interventricular artery. However, in 15% of individuals, the posterior interventricular artery is a branch of only the left circumflex artery, and in the other 15%, the left circumflex artery and right coronary artery anastomose to form it. The posterior interventricular artery runs down the posterior face of the heart between the 2 ventricles and supplies blood to the posterior left ventricle and the posterior 1/3 of the interventricular septum. The right marginal artery follows the acute angle of the heart, supplying both surfaces of the right ventricle.
The venous return from the heart is carried by the coronary sinus, which runs along the posterior aspect of the coronary sulcus and terminates in the right atrium. There are 5 main tributaries which drain into the coronary sinus. Anteriorly is the main tributary, the great cardiac vein, along with the small cardiac vein. Posteriorly lies the middle cardiac vein, the left marginal vein, and the left posterior ventricular vein.
In the heart, there are anatomical remnants that remain from embryonic development but no longer have a function in the adult body. The remnants include the ligamentum arteriosum, a fetal remnant of the ductus arteriosus. It connects the aortic arch and pulmonary trunk and allows most of the blood from the right ventricle to bypass the fetus's fluid-filled, non-functioning lung. Another remnant is a depression on the posterior wall of the right atrium, known as the fossa ovalis. The fossa ovalis is the remnant of the foramen ovale, which allowed blood to pass directly from the right atrium to the left atrium in the fetus, again to bypass the fetus's non-functioning lungs.
That concludes our video. Thank you for listening, and we hope you found it useful.